Hello, everybody, and welcome back to another episode of Medical Minute. My name is Steve Abbott, Executive Director of Cincinnati Cancer Foundation. As always, we're presented by Kroger Health, and we're pleased to have here today Amber Starkey from the Little Clinic, representing the Little Clinic. So she'll tell us a little bit more about that. I think there's pharmacies in almost every store, but not necessarily a Little Clinic in every store.
Correct. Most of our all of our Krogers have a pharmacy, but we have about 225 clinics in our Kroger stores over 9 states. So we have been growing, and we are continuously growing, and we're excited about that. But thank you guys for having me here. I'm excited to be here, and I am one of the regional clinical leaders for the Little Clinic, so I actually oversee all of the Little Clinics in Northern Kentucky and some in the greater Cincinnati area.
Oh, God's country. That's where I live. In fact, I stopped on the way in today to pick up a prescription at the Kroger store, at the Kroger pharmacy.
Yeah, Kroger pharmacy.
Yeah. So we've covered this in little pieces on past episodes, but the Little Clinic is now to the point where you can almost consider it almost like a primary care office, correct?
Yes. So and what I feel is really great about us is that we have those clinics that can see pretty much everything. You go into your primary care office, we can do it too, but it's outside of that regular time frame. Like if you're you're a working mom, or your kids are in school, you might not be able to get to the doctor's office during their hours. And we have weekend hours, we have evening hours to make it more convenient for our patients. So I think that's what really sets us apart.
That's great. And so one of the things we want to talk about today is kind of cardiac health. And one of the things, when we exchange some email back and forth, and so we can give it a little bit of that spin too, but then I'll ask Jill to kind of talk in a minute about kind of how we do things here and our full physical exam that we give and what we're looking for when we do that as well from a cardiac perspective. But one of the things I mentioned in some of the email that we traded is that as a 10, coming up an 11-year cancer patient myself, and then my wife is a breast cancer patient who also works here. But one of the things I've noted is that over the years is that, there are certain comorbidities that can come along with cancer. And as we know, I mean, you kind of, when you're a cancer patient and you're being treated for that, you don't always think about the fact that how many cardiac events there are that can happen and how that can be complicated by things like chemotherapy and things like that. So it really, in my experience, and Jill, you correct me if I'm wrong, it often doesn't really get the attention it probably should get as part of an oncology visit.
Yeah, that is a very valid point in regards to, patients will come in and you also are looking at their underlying health issues that they had before their cancer diagnosis. But a lot of the drugs alone that are given for the treatment of all of the different types of cancer, there's not just one, it's not like just breast cancer or prostate cancer or lung cancer. There are drug classes all along the cancer treatment spectrum that can cause cardiac issues. And so when we're talking to our patients, a lot of what you're doing at the Little Clinic on, making sure that people are staying heart healthy helps to combat what the drugs are already, potentially going to cause.
Yeah. And is that something, so Amber, if someone comes in as part of, and maybe and this will involve, I think, maybe you giving a better explanation for something I maybe don't fully appreciate yet. Do people come into the Little Clinic as a result of something acute happening, like I got a problem and I come in, or is there a possibility that could become kind of their own version of going to, could they just make an appointment for a wellness check?
Yeah.
Okay.
That's a great question. We see everything that walks in the door. So if someone's coming in, say, my belly hurts, or I think I have a cold or a strep throat, they can definitely come in. They can walk in, but they can also make appointments. And we do that just for the convenience of our patients, and especially patients with little children. We've all been, to the doctor with little kids, and waiting is, not something that comes very easy. So we did implement appointments a few years ago, which is really nice. So so you can definitely come in for anything acute, happening. But you can also come in saying, I need a physical, or I do want a wellness check. Can I have a biometric screening? And we do those. So the biometric screenings, as to your point with heart health, it gives us a good idea of that person's, health status. So it will give us their glucose, their blood sugar. It'll also give us their cholesterol numbers. So their HDL, which is their good cholesterol, LDL, and their triglycerides, and give us a total number. And we kind of all know that, if your cholesterol is a little bit high, that can put you at increased risk for a cardiovascular event. So us having those tools that we can screen those people and it be more of a preventative, measure, it really can save someone's life. If someone comes in with a cholesterol of 350, we can treat that. We can say, what, let's go ahead. Let's get you on some medications. Let's get other blood work too. Let's make sure you don't have diabetes. Let's make sure that your kidney function, your liver function is okay as well. So we can do so much. And I think it's a common misconception with the little clinic that we're just here for colds or shots or something like that. But we can really treat the whole person.
I actually have had patients that we have referred because they don't have access to potentially a blood pressure cuff at home. And some of the medications that we give can also raise blood pressure. So in the intention of doing kind of a close monitoring without having to ask the patient to come into the office every time to get a blood pressure check, I tell them, hey, the next time that you're at your Kroger, see if they have a little clinic. They have the ability that you can walk in and get a blood pressure check, and they'll keep it on a card for you and give it back to you, and you can kind of monitor that and then bring it back to me when you come in for your next visit.
And it's free too. You can just come in and ask for a blood pressure check and we will monitor it for you. We'll put it on a card, like you said, and then they can have that for a record. And that really makes a difference because I think a lot of people think, we have to make an appointment for something like this. Like, no, we want to try to make it as convenient for people as we can because we're convenient care. So if you walk in and you need that, we'll get you taken care of.
I know that Kroger's I think maybe the world's largest florist. But you guys have got to be one of the largest pharmacists, I would think, at this point, right?
Yeah, we do have a lot of pharmacies, in the area, and it's spread throughout. And with Kroger, we have different, we have Kroger, and then there's King Soopers, and so there's different, different entities of it. But yeah, we have pharmacies and Krogers and all of the U.S. So it's pretty amazing.
And Jill, because it was interesting what you just said, because that's one of the things too I wanted to talk about. That's a little different here, I think, when someone comes to Cincinnati Cancer Advisors is due to the length of our appointments and I mean partly just our values and what we're looking for and the experience we're looking to provide. I mean, we really do a full physical exam. So and I'm just curious myself, when a patient comes in, I mean, are they getting? I mean, we're listening to their heart. We put a priority on that, correct?
We absolutely do. And I actually can, even speak to a patient that we had come in. They had been a fairly new diagnosis, had started on treatment. The treatment that they were on wasn't necessarily considered cardiac toxic. But we were doing that in-depth physical exam and listening to the patient's heart and picked up some abnormal heart sounds. And so, so then as soon as you hear something that sounds a little off, then you really start listening. And he had, he had kind of a rub that was going on, and he had a new murmur that wasn't there before. And he was a fairly younger gentleman. And so we ended up calling the patient's treating oncologist. He ended up getting a stat echo because we picked it up. And in his instance, they actually found that he had metastatic spread of his cancer into the heart tissue. Oh, wow. However, he was completely asymptomatic. He wasn't having any issues with activity. He wasn't having any shortness of breath. He wasn't having any chest pain. But what picked it up was that in-depth physical exam that we had done that day.
That's very cool. And you just said you violated one of our rules. You said stat echo. So you got to explain what that means.
Okay, so a stat echo would be, an echo is an echocardiogram, which is kind of an ultrasound that looks at all of the function of the heart. It looks at all of the chambers. It looks at how the blood is flowing and all of the vessels around it. And so stat would be that we ordered it, and they ordered, I mean, y'all have seen the medical TV series, everything has to be ordered stat. We want it done right now.
I would submit that stat is equal to Jill time. That's how we do things.
Yeah, I pretty much want everything done stat.
So Jill and Amber both, but so one of the things I often talk about when I talk to other people about cancer is that even though in many cases it's still dire and can have bad prognosis and outcomes, there's also a lot of reasons for hope because it's not the same cancer we grew up with. It can be found earlier. There's more ways to treat it and things like that. I think it's safe to say, I think it's fair to say that applies also to heart disease, right? So you hear a term like heart failure, and that sounds imminent, and it sounds like, oh my Lord, you're going to die like soon. And heart failure can be managed for a good long time, right? So I guess there's statins and other things like that, other drugs that can wick moisture away and different. But if you can kind of talk about that a little bit too, because I don't think even heart failure on the continuum is quite as scary as it used to be.
I don't feel like heart failure in itself is as scary. I mean, it's not that it's any less serious. Yeah. We just have better tools now than we had before. And I think that we all have gotten educated just on lifestyle changes that can significantly improve some of these chronic conditions. And Amber, you can speak to this, the fact that I think the little clinic in Kroger Health have access to dietitians because diet is huge when we're dealing with some of these chronic heart issues. Obviously, the medications that are prescribed by the physician, physical activity is a huge one. The more active patients are, the healthier they are, and we say that with our cancer patients. When we talk about what are some of the things that you can do to make treatment and make getting through your cancer easier, Dr. Lemming, our medical director, always quotes George Sheehan, who was the medical editor for Runner's World. And he said, you do all of those things that make you a healthy animal. And so, with having that in mind, I feel like that Kroger Health really has come alongside of the community to help ensure that they're doing all the things that make them a healthy animal.
Yeah. No. I mean, that's a great point. And with our nutritionists, it's really nice because they're ours, like we're not referring out. Like we have dietitians with Kroger Health, and that has been something that's really been helpful for us because it has been something that it's been missing. When people come in and they might be a little overweight and they want to know, how can I help? How can I help myself? And we can now refer to dietitians. And what's so great about them is that you can just do it over video. It's a virtual consult. So, for people who could also, this is a very, it's a valid point for people who are bigger, who might not be able to move and get to a doctor's appointment as easily as someone else's. They can do it on their phone, and that's huge. And we accept insurance for that, and there's also prices for prompt pay for patients who don't have insurance that would need help of a dietitian.
So Dr. Lemming quotes George Sheehan, and I quote Jerry Seinfeld on a pretty regular basis, but that's where I get most of my lines from. But Amber, just out of curiosity, so let's say in this scenario, let's say maybe someone is on a statin or on some sort of kind of heart drug to improve heart function or something like that. And I know Kroger has great systems that are tied together with all sorts of information, but is there anything that, like a little flag or a trigger that's, that says that they're going to pick up a medication like that suggests maybe they go get their blood pressure checked or get a cholesterol test done?
And I can attest to the little clinic. So if somebody were to come in and they were to have that medication, we make sure we reconcile all of our medication. So even if you're coming in saying, hey, Amber, I stubbed my toe today, we're still going to go through all of your medications and making sure that you have proper follow-up for that. And we'll do a full head-to-toe assessment. And we can look at things and say, you know what, it looks like you're on lisinopril, which is for high blood pressure. Have you been getting your blood pressure checked, or do you have a blood pressure cuff? And if you don't, let's see how we can go about that. Because most insurances will give you a blood pressure cuff, with insurance. So just in making sure that they have the tools that they need, because sometimes doctors, they're great, but they're in and out. There's so many patients. You're seeing a patient every 10 minutes that they might not be able to get the full picture. And we can slow down. We can slow down and say, we need to make sure that you are seeing a dietitian. We need to make sure that your salt intake is where it needs to be because you have high blood pressure. Let's check your A1C to make sure you don't have diabetes, because we also have to remember that when we have a comorbid like heart disease, it puts you at a greater risk for having high cholesterol, having high blood pressure, having diabetes, and just making sure that we're treating the whole patient.
That's cool. As a side note, there's a whole episode of Curb Your Enthusiasm where his pharmacist disagrees with the medication that his doctor prescribes, and Larry wants to go with the pharmacist. So you got to see that at some point in time. It's pretty funny.
And that happens quite a bit. And pharmacists, they have a lot of checks. When they see a medication, they can see if there's an interaction with another medication, and if there is a major reaction, they will consult their providing physician, or just ask the patient, hey, have you been taking this for a long time? Are you feeling okay? And just it's always nice to have that double, triple check, not only us as a provider providing that medicine, but having the pharmacy look at it too after we do our due diligence.
Very nice. All right, well, everybody, it's been great, Amber, being with you today. I mean, one of the things we often talk about here is we keep trying to make our oncology practice better and better and better. It's only as good as how many people know about us and can access the care we can provide. And so it's always nice to be able to kind of make more people aware that, a Kroger store that's going to be nearby to you has a level of service that it does. Because I just speak for myself, you get busy, and sometimes it's hard, especially on the kind of the more wellness-oriented things. Oftentimes you do respond to the things you have to that are acute, but it's hard to sometimes make time to do those base level wellness checks that you should do. So it's nice to know that that's there and available and accessible. So thanks for coming in today.
Thank you for having me. I had a great time. I appreciate it.
All right. Maybe I'll see you in Northern Kentucky someday.
Yeah, I'll see you. Please come and see us.
All right. Sounds good. Thanks, everybody. Thanks, Amber. And thanks, everybody, for joining. And we'll see you again soon on Medical Minute.